Hello everyone, welcome to my channel again. Well, first of all, I hope that you all okay and stay safe in the pandemic. Once again, today I will share some tips, experiences on what to do in some instances or situations while you're working on the floor as an LVN, or for any nurse out there that is starting, that doesn't have too much experience. So just some tips. First, I'm going to talk about high blood pressure on patients. So if you find a patient that has a high blood pressure, let's say above 180, which is very high already, first thing you need to do is give the BP meds right away, and then check within 1 hour after you give the medications to follow up on the BP, and check if on the MAR if the patient have any PRN nitroglycerin ointment that is usually ordered by the doctors for patients with high blood pressure. Apply as well right away. Normally this applies for patients that are systolic blood pressure of 180 or higher. So just follow the parameters that the doctor have set for these BP meds for this patient. And also, if there is no parameters, just follow the hospital that you work at or the facility that you work at. They have their own protocols for BP meds. So be sure you know your protocol for BP meds, whatever you work, because it's very important that you apply this. If there's none, then please, you have to notify the MD right away and ask the doctor if they would like to order something else, like another medication, or if the patient doesn't have yet nitroglycerin ointment, if they would like to order this as PRN. Normally we do that for patients that have very high blood pressure, and you want the blood pressure to go down fast. And follow with the patient, see if the patient is have any symptoms, have any headaches, and if they do, inform the MD also about these symptoms right away. If they say no, they don't have any headache or anything, then you can tell the doctor resident or patient is asymptomatic. It's very important that you follow up after 1 hour, 1 hour and a half, to ensure that the blood pressure is actually decreasing and that is getting better. If the patient continues with high blood pressure, it's very important that you tell the doctor the medication you gave, you follow up, you check blood pressure again. The patient continue with high blood pressure, and then the doctor will decide what to do in this situation. Always don't forget to document follow-up BP. So if you had a BP originally of 184, 190 systolic blood pressure, and then later on you check 1 hour later and it went down to like 160 or 150 something, excuse me. So be sure you document that you're following up and what the BP was at that time when you check the second or the third time, and always endorse to the next shift, the next oncoming nurse about this BP, and put on your notes the name of the doctor that you notified regarding this patient's high blood pressure, and what the doctor ordered or what the doctor said, what was the order from the doctor. Don't forget to document all these things. Very important, because if you forget to document, it can come back to you. If something, let's say something happened to that patient and then there's no documentation, and you say, you know in your heart that you did follow up and you did it, but you forgot to document, it's not going to help you if you forgot to document. That's your defense, your documentation. So if something happened to the patient, you say, well, I follow up, I told the doctor this is what he ordered or she ordered, and so that's your defense. Don't forget to document, please. Secondly, I'm going to talk about skin tears. For example, you have a patient that bump the arm with the chair or with the bed and some corner or something, or like they were getting a blouse or a shirt on them, and then when they pull the arm, they got skin tear, whether on the arm or on the hand. Normally they will be bleeding, and some patients they get nervous when they start bleeding, and they say, "Oh, what's gonna happen?" And then they don't want to see blood. So my recommendation to you is the first thing you want to do is clean the skin tear. You want to get the necessary tools that you need. Get some gauze wound cleanser. In terms of cleaning, regarding peroxide water, my experience, I would say use peroxide water only if it's a new wound to clean and disinfect. If it's an old wound, I don't recommend using peroxide water because many times the peroxide water will just make the wound worse. Maybe the peroxide water will kill the good bacteria that is growing in there in the wound, and maybe we get an reinfection or infection in the wound. But always follow your doctor's order and the facility protocol for wound treatment, wound cleansing. So what you want to do is if the skin is still hanging to the wound, to the side that the tear is, you want to clean it with a wound cleanser. Then you dry it gently, and then with the Q-tips you will cover the wound again with that skin that is hanging there, and then you're going to apply Steri-strips. If you don't have a Steri-strip, be sure you order get some Steri-strip from the pharmacy or from your central supply room, whatever you get your supplies from. Normally most facility they will have Steri-strips available on their unit because at some point you're gonna need it. So just apply Steri-strips and let it at open air. Don't cover it with gauze or with anything else. Normally skin tears will heal very fast if they're left at open air. Just depending on the size of the skin tear, you put 3 or 4 Steri-strips, leaving a few spaces between each Steri-strips that will allow the air to dry the wound, and for that reason the wound will heal. In a few days it will be healed. Most of the time it will heal in a few days. And then ask the doctor, once you do that, you ask the doctor or you tell the doctor this patient had a skin tear. Don't forget to measure and write down on your notes the measurements for that skin tear, the location, and what you apply. And then don't forget to mention that you notify the doctor. You tell the doctor, this is what I did. Would you like to change the treatment, or if you would like me to keep this treatment? Just as long as you ask your doctor what they like to order, if it's okay. If they say yes, that's fine, then they need to give you an order. Include the location on the order. It's very important. And then how to change it daily, Q shift, or PRN when soiled. All those things need to be specified in the order. You always need an order for these things. You can treat the skin tear before you get the order, but don't forget to tell the doctor what you did, and if they want to keep that, don't forget, please. And then secondly, thirdly actually, we're going to talk about itching skin on patients. Sometimes patients will say, oh nurse, my skin is itching, my arm, my back, can you give me some lotion? Usually helps me. Never apply lotion to a patient without a doctor's order. Even though it's a lotion, it's still considered medication, and then you will need a doctor's order for that. And the reason why you don't want to apply it before you get a doctor's order, because you don't know if the patient have allergies to this lotion or to whatever medications are made on this lotion. And if you apply something to a patient and they'll develop a allergy, then you're gonna have to do some explaining to the doctor. It's your responsibility. First, get the order, because you don't know what the doctor is gonna order. You might apply something and then doctor orders something else. It just happened, oh, the patient is allergy reaction to whatever you apply, and then you'll be in trouble. So please get an order first, tell the doctor what they like to do, if they want to order something, and document whatever the doctor ordered for the patient. And follow up on any reactions of if it improved the itching, or if you have rashes, if it's improving or not. And then let your charge nurse on the oncoming shift give on the report information, and if it's doing better or not, or if still the same. Just don't mention. Please monitor this itchiness on right arm, right leg, on the back. Don't forget to always mention the location of the issue of the itchiness. Okay, so I hope these three things are helpful to all of you new LVNs. Remember that always, whatever you do on a patient, you need to have a doctor's order prior to. If the doctor give you a verbal order, and it's okay to do it with the verbal order, later on the doctor will put the order, and just don't forget to tell the doctor, don't forget to give me the order for this thing that you ordered for so-and-so for the patient. And it will be okay to do things. If the doctor give you verbal orders, don't forget to write the order, time, date, and the name of the doctor that gave you the order. Always very important to write those things. I hope that with these things you learn something that is useful for some of you. If you have any question, any comments, please make a comment. Give a like if you learned something from me today, and don't forget to subscribe to my channel. I hope this is of help, some information, and until next time, I will be making my next video. I will talk a little bit about cold blue, what to do in a situation when you have a cold blue on your unit, on one of your patients, even if it's not one of your patients, on what to do on a cold blue. Subscribe to my channel and give a like. Thanks for watching. Until next time. Bye-bye.